All right.
Yep, you are good to go.
Well, perfect. Hello, everyone. My name is Mark Lender. I'm the market liaison here in Virginia. Essentially, my role is to reach out to schools just like yours, as well as pediatric primary care practices, and really the community as a whole to educate them on all things Blackbird. We're certainly excited for today's presentation, and we thank you for taking the time out of your busy day to join us. Caitlin, if you could go to the next slide. To provide a quick introduction to Blackbird Health, we've been around for 11 years, mostly in Pennsylvania. And about a year and a half ago, we started to expand with our first location here in Northern Virginia. We launched an in-person clinic in Tysons, which is right off Old Courthouse Road. We have plans for a second location launching in June, and then a third location by the end of the year, all here in Northern Virginia. We offer comprehensive evaluations and assessments, as you can see here, as well as an array of different treatment options that are at our disposal. We do offer a hybrid solution, meaning that about 95% of what we do, we can also do virtually. We have over 30 providers licensed here in Virginia, made up of child adolescent psychiatrists, CRMPs, psychologists, and social workers. We do accept all major commercial insurances as well as TRICARE, and we see kids aged 2 to 26 of all complexities. Next slide, please. About 85% of our patients see a clinically significant improvement in 10 to 12 weeks, and we tend to be about 20 to 40% below industry standards in terms of our prescriber rates, and we believe that's the case because we take a little bit different approach to mental health. Our clinical model is really rooted in what we refer to as our understand first approach. So all of our patients start off with a comprehensive assessment where we go beyond the surface, uncovering co-occurring challenges and underlying causes that others may miss. And then that allows us to build a customized care plan that may include various therapies and, when appropriate, prescribing medications. Today, our speaker is Caitlin Kolba, and she will be presenting Parenting Anxious Children, Shifting Parenting Patterns to Reduce Anxiety and Increase Resilience. So at this time, I will go ahead and pass it over to Caitlin to get us started.
Great. Thank you, Mark. It's a bit of a tongue twister. So my name is Caitlin Kolba. It's great to meet everyone. I am a licensed clinical social worker, a certified clinical trauma professional, and a certified clinical anxiety treatment professional. I actually lived in Virginia for about 20 years of my life in Fauquier County and now have relocated up to Pennsylvania. Unfortunately, Patrice is not able to be with us tonight, but she is often my counterpart on these presentations. So I have been working in the mental health field for approximately 13 years. I joined Blackbird in 2024. My real draw to Blackbird was the unique approach to neuropsychology, this comprehensive integrated treatment model that we offer, just so that we're really aiming for better outcomes for children and for families. So I love the strategies that we're able to implement and the way that things just click and really seeing a lot of those changes. So why are we talking about anxiety? Anxiety disorders are the most prevalent psychiatric condition among children and adolescents. So we are looking at almost 1 in 12 children, 1 in 4 adolescents experiencing clinically significant anxiety. These disorders can encompass range of conditions and diagnoses. This can show up as generalized anxiety disorder, social anxiety disorder, phobias, separation anxiety disorder, and there's lots to talk about in this topic. So what we'll cover today, first, we're going to explore the root causes of anxiety in children. So anxiety can stem from a variety of factors. This can be genetic predisposition, environmental stressors, developmental changes. Then we'll discuss some practical evidence-based strategies to help children manage their anxiety in these everyday situations. We'll explore the importance of creating a supportive environment that fosters a sense of safety and predictability. And then we will look at ways to help build resilience, equipping children, parents with tools that they need to help build that long-term well-being. So our goal by the end of this session is that you'll have a deeper understanding of anxiety, some tools to help support children effectively, and some strategies. We'll also offer a Q&A at the end. If anyone does have any questions or needs something repeated at the end, happy to chime in there. So, understanding anxiety in children. Anxiety is natural. It's often a very necessary response to stress or danger. I think each one of us can say we have experienced anxiety at some point in our lifetime. It's our body's way of preparing to face a challenge, whether real or perceived, whether before a big test, a big performance, or just an uncertain situation overall. We often describe anxiety as a feeling of worry, nervousness, unease about uncertain outcomes. So this can range from mild discomfort, I'm a little bit tense and uncertain, to overwhelming distress. I am having a meltdown, panic attack, and I am unable to function, and everything in between. So it's important to recognize that anxiety is not always negative. It serves a really important function, keeps us alert, helps keep us safe, keeps us prepared, but there are times when it can become a little bit out of control or unmanageable. So 4 responses to perceived threats. We have got fight, flight, freeze, and fawn. Those are typically the way that our body responds to stressors. Those are the 4 primary stress responses that the human body activates when we perceive a threat. During the fight response, our body physically prepares to attack the perceived threat. That may look like blood drawn into the core of the body, which causes some tingling in the fingers and a lot of tension and a lot of alertness. And that can manifest as physical aggression, anger, hypervigilance. Flight response, all that adrenaline floods and we are ready to escape whatever that stressor is. This can look like restlessness, panic, fidgeting, running away when we're talking about kids, especially in the school or home environment. A freeze response would be when the body is unable to move or to act against that threat and almost looks like physical paralysis, shutting down, dissociating, very flat, emotional, numb responses to the circumstances. And then the relatively new addition to this group is the fawn response. So this occurs when the body tries to please someone or to mitigate that stressor, which can look like people pleasing, codependency, conflict avoidance. Each of these responses are their own individual way of trying to address, avoid, fight back, or escape a perceived stressor. I love this diagram because this helps us see how in each of these different age groups, a lot of these anxiety symptoms intersect and where the similarities and differences lie in different age groups. So each of those 4 stress responses serve a purpose. If we are out in the Sahara and then being chased by a lion or being threatened by a wild animal, those are the things keeping us alive. But when we have to give a presentation, talk to our boss, for our kids to, give a book report in school, those are not the times that are most appropriate for us to react as if we were being chased by the lion. So we have to talk a little bit about when this is normal versus when this becomes excessive. Anxiety is normal in small doses, but when it is persistent, intense, overwhelming, very big response to a perceived small stressor, difficult to control, disrupts daily life, this can indicate that there's a bit more of a problem going on. If it's consistently affecting someone's emotions, thoughts, behaviors, physical well-being, causing distress, disrupting one's normal routine, those are times where we may need to look at this is not considered a normal amount of anxiety. So common triggers for anxiety, we've broken this up into children under 10 and children 11 to 17, often because this manifests differently. There's a little bit of an intersect there between what might be considered elementary school and middle school. So these are a little bit flexible, but in general, there are some differences. Children under 10, common triggers include separation anxiety, fear of being abandoned by, apart from, or that harm may come to their parents or caregivers if they are not with them all the time, or that harm could come to them if they are not protected by their parents all the time. Fear of the unknown can look like anxiety about new experiences, environments, or people. I see the comment. Is everyone able to see the PowerPoint presentation? Okay.
Yeah, it might be because he's just on a cell phone. I'm not sure.
Sometimes swiping left or right on the phone might open up the shared screen for you. Performance pressure with children under 10 can look like fear of failing in school, fear of messing up or losing with sports games, activities. This can manifest as phobias, specific fears like fears of specific animals, fears of getting sick, afraid of the dark, fear and aversion to loud noises. In older children, this often can manifest as triggers for anxiety with social pressures, fear of judgment or rejection by peers. There's a lot of peer pressure, a lot of social media influence once we get into these older age groups. Academic stress, performance to perform well in school and to meet personal, parental, or academic expectations. Body image concerns, concerns about appearance, physical stature, hormonal changes impacting the way that this age group manages anxiety symptoms. They can feel different in their body than what it felt like when they were younger. And just future uncertainty, worries about moving from middle school to high school to college, what happens after graduation, what to do as far as a career, what are my life goals, all of those big questions. Unexpected causes of anxiety. So I think the things we just talked about are pretty common explanations. Some of these are ones that we don't often think about can be triggers for anxiety. The top one being food sensitivities. So this can be undiagnosed food sensitivities causing discomfort, inflammation. A great example, which we have tried to include some examples of specific things we have seen within our clinic, adjusting for HIPAA compliant discussion. We had an individual in the clinic, 8 years old, coming in with frequent stomach pains, frequently visiting the nurse, high anxiety, a lot of fear about throwing up, getting sick, contracting an illness from someone else, and learned that what was really going on was actually a dairy sensitivity. This was causing an intestinal backup that resulted in stomach pain, nausea, discomfort, and that to this child felt like the stomach pains of being anxious when really there was no true anxiety trigger. This was some food sensitivities contributing to those feelings. Parental stress. Our kids absorb our stress as adults. They see us stressed, they feel it coming off of us, and it can make them feel overwhelmed. It can exacerbate their own anxiety. Great example of this is an individual that I personally worked with. Through some family therapy, we identified that this 6-year-old individual, out of the blue, started to wet the bed after that was never a problem previously. And there was a lot of, surface level discussions going on until we realized that the parents' stress and tension at home had really increased. Dad was very visibly stressed out from some work challenges going on at home. It wasn't really being talked about, within the family unit, but we realized that a lot of that increase of parental stress, truly correlated with that child's increased behavior of bedwetting. So when we were able to use some mindfulness, the family was able to spend some low pressure time on activities, that bedwetting completely stopped. So there are ways that anxiety can show up from some of these unexpected causes that we may not realize that's what's going on, but kids are more attuned to some of that than sometimes we realize. Sleep deprivation can be a big one. Lack of adequate sleep disrupts emotional regulation, increases cortisol levels, makes it harder for us as parents or for our kids to really be able to emotionally regulate if we are already sleep deprived and on edge. Social media, exposure to unrealistic comparisons, bullying, constant stimulation, constant access to information can really heighten that anxiety. Hormonal changes, fluctuations in hormones, and especially as puberty begins and intensifies, those emotional responses can intensify. And a lack of downtime, like between social media influences and expectations that we have of ourselves and our kids. A lot of times it is wake up, morning routine, go to school, academic routine, sports routine. There's not a lot of downtime for them to really learn to rest and self-regulate and to manage those stressors. And sometimes that can look like overwhelm that comes out in one of those fight, flight, freeze, or fawn responses. Some other diagnoses that may manifest as anxiety. This is going a little bit deeper into some co-occurring diagnoses or things that some of our kids may be diagnosed with that can also increase their risk of showing some unmanaged or unmanageable anxiety symptoms. So, social pragmatic disorder, this creates difficulties in understanding and responding to social cues, interpreting nonverbal communication, navigating social interactions. That can lead to feelings of frustration, isolation, constant fear of making mistakes in social situations. Intellectual disabilities and cognitive delays can contribute to anxiety by causing individuals to struggle with processing information quickly. This can lead to more comparisons, feelings of being overwhelmed, inadequate, unable to keep up in situations that require quick thinking, which can trigger worry and apprehension. Learning disorders can cause anxiety in childhood by creating a constant feeling of frustration and inadequacy due to the difficulty of keeping up with peers academically, leading to feelings of being different or behind. This can cause additional anxiety about schoolwork or avoidance of schoolwork altogether. Speech and language disorders can contribute to anxiety by making it difficult for children to communicate effectively with family members, peers, and teachers. This can lead to feelings of frustration, isolation, fear of social interactions, which can later turn into social anxiety. Children with these disorders may also struggle to understand instructions or to express their needs, which can further exacerbate that anxiety in social situations. Poor memory, that can manifest anxiety by causing someone to worry excessively about cognitive dysfunction and decline, leading to a cycle where the anxiety itself further impairs memory. The more that we feel stressed, the more that we are anxious, the less we are able to really articulate ourselves or to be able to fully retain some of the things going on around us. Medical conditions. This can cause anxiety in childhood, feelings of fear, uncertainty, lack of control due to physical pain, enduring a lot of invasive procedures, regular disruptions to daily life, and threats to health, especially when we're dealing with chronic conditions, frequent hospital visits or treatments that are painful or scary. This can lead to an almost constant state of fight, flight, freeze, or fawn, that heightened state of worry and anxiety about their health and well-being. And ADHD. ADHD, I think, within this list is probably the most common diagnosis, but ADHD and anxiety often go hand in hand, but they're not the same thing. ADHD can manifest as anxiety when the brain struggles with executive functioning. This can look like difficulty managing time, remembering tasks, staying organized, and can create a constant sense of stress and overwhelm. People with ADHD may feel anxious about forgetting important things, missing deadlines, or struggling to keep up with daily responsibilities. And all of these symptoms can, over time, start to mimic or fuel anxiety, even though they're truly ADHD symptoms. So what happens if they're not addressed? Long-term impacts if we are not addressing these symptoms when they're coming up. Mental health, relationally, and academically. So under the mental health umbrella, we are looking at the potential for chronic stress. When anxiety becomes chronic, the body stays in a constant state of stress. This can lead to further sleep disturbances, digestive problems, increases risk for heart disease over the lifespan, makes it harder to relax, think clearly, and cope with everyday challenges. Anxiety often does not exist alone. It commonly coexists with other diagnoses, as we just talked about, which can coexist with depression, ADHD, obsessive compulsive disorder, things like that. This can make treatment more complex, as symptoms of one disorder may fuel another. Low self-esteem, persistent anxiety, a lot of those situations that we talked about inadequacy and feeling insecure in their decisions or in their experiences. And that persistent anxiety can lead to self-doubt, negative self-talk, and making individuals feel really incapable. Within the relationship umbrella, if long-term anxiety is not addressed, this can lead to social withdrawal. People with chronic anxiety often avoid social interactions due to fear of judgment or embarrassment. This can lead to loneliness and isolation, difficulty forming friendships. Conflicts with peers. Anxiety can make individuals more irritable or sensitive, leading to misunderstandings and increased conflicts with peers or classmates. Family tensions. Anxiety creates strain between family members. Parents may struggle to understand their child's anxiety. Siblings may feel neglected, frustrated. And in some cases, individuals with anxiety rely so heavily on the family for reassurance that can create burnout for parents as well. And the impact to academic performance. Anxiety makes it hard to focus. If we are panicked, if we are stressed out, we are not focused on what's being taught in math class. We're not focused on what's going on around us other than survival. So the brain is so preoccupied with worry that tasks like math, reading, listening to instructions, completing assignments becomes completely overwhelming. This can look like procrastination or difficulty retaining information when in reality, it's anxiety influencing that concentration. Declining grades. As concentration and motivation drop, academic performance suffers. So even students who were once high achievers may struggle with keeping up, which then increases frustration, that increases the anxiety and feeds into that cycle. This decline can trigger self-doubt, reinforces that cycle of academic stress. And then school avoidance. Sometimes it truly just becomes so great that some students begin to avoid school altogether due to anxiety about tests, social interactions, or speaking in class. This can lead to missed learning opportunities, academic gaps, and difficulty reintegrating later on. So we've talked about some of the ways that anxiety shows up. Part of the purpose of this presentation is to talk about how we as parents may unknowingly incite, model, and reinforce anxiety for our kids. So some parenting patterns that influence anxiety. The first is parental accommodation. This looks like constantly stepping in to try to solve problems or shield our children from discomfort. This can be, in an example, if we have a child who has severe anxiety when going to school, they are crying, they're upset, their stomach hurts, they don't want to go, and we say, "It's okay. We don't want you to be upset. I want you to feel okay. You don't have to go today." Over time, our kids start relying on staying home as a coping mechanism rather than learning to cope with the stress of actually going to school. So this just reinforces the avoidance and makes it harder to build that resilience to any anxiety-provoking situation. By accommodating their avoidance, we are unintentionally reinforcing the idea that a particular person, place, or thing is something to fear, which prevents them from developing coping skills and gradually facing those fears. Parental inconsistency. This can look like unpredictable rules, expectations, or responses to behavior. This can be, we have a rule that at 7:30 p.m., all electronics are turned off, no more TV, no more iPad. This is going to be a calm environment. But tonight it's a fight and I'm exhausted and I don't feel that I am able to reinforce that, so I let it slide. This inconsistency creates confusion and makes it difficult to establish a sense of predictability, security, and those two things are essential for managing anxiety. Even though there may not be a lot of anxiety in that situation specifically, this can lead to children continuing to push boundaries, knowing that the rules are not consistently enforced, and recognizing that there is not a consistent expectation to constantly have to meet. Overprotectiveness. This can look like restricting independence or taking excessive precautions, and is always coming from the best place inside of us. This is insisting that we accompany them to a birthday party or a social event, reminding our kids frequently, be careful, mind your surroundings, take this with you, watch your step, which, even though it is coming from our truest heart of hearts, it truly is impacting our kids' anxiety and sending the message that the world is unsafe. It fosters a fear of risk taking. It makes it harder for them to truly understand that they can take risks and that we are here to help them should they struggle with something, but the risk taking is important. And the final parental pattern that can influence anxiety is our own anxiety. We as parents have anxiety. We are human. When we openly worry or we are exhibiting stress responses in front of our kids, for example, what are we going to do about paying the bills? What are we going to do if you fail this exam? You need this to get into college. What am I going to do if I am laid off? There can be a lot of questions and a lot of uncertainty that we just express out loud because we're experiencing it ourselves, but our kids absorb that anxiety. They mirror that stress and those worry patterns, even though that is not our intention of just speaking those things out loud. So we're going to shift away from the doom and gloom of that piece and talk about some strategies for shifting some of those parenting patterns. We've explored some of those unhelpful patterns that can contribute to our kids' anxiety. So let's focus on some practical strategies to shift those patterns in a positive direction. Reducing parental accommodation by gradual exposure, encouraging small steps to face fears, and we have some specific examples. This could be a fear of dogs. If you have a child who is constantly afraid by neighborhood dogs barking, doesn't want to walk by them, doesn't want anything to do with them, wants to cross the street or not go outside and play, start small. Start by looking at pictures of different breeds online. Start by increasing the education surrounding why dogs bark. Gradually progressing to watching videos of friendly dogs playing, visiting a park and observing them from a distance, and then eventually introducing them to a calm, well-trained dog with the owner present, allowing them to approach at their own pace and giving them verbal encouragement to do so. Test anxiety can also be something that needs gradual exposure. Reviewing a few practice questions in a low pressure, quiet environment at home, gradually increasing the difficulty and duration to help simulate test-like conditions with a timer. Introducing light distractions such as background noise to mimic real test settings, and then eventually having them complete a full-length practice test to help build that confidence. Skill building through practice and role play can also be very helpful. So teaching our kids how to ask for help in a store. If we have kids who were in the generation where people buy things online, The idea of going into the store and asking for help finding something is very scary to a lot of our, especially teenagers. So practicing at home by role-playing a scenario where they ask the store clerk, which may be parent, sibling, for help with finding an item, encouraging eye contact, clear voice, polite wording, and then escalating that up over time to visiting a store and having them ask in a real-world scenario. Same thing with responding to teasing or bullying, really starting to role play assertive communication. I don't like when you say that to me. I am asking you to please stop saying that to me. Reinforcing body language like standing tall, making eye contact, discussing when to walk away, when to seek help from an adult. Really starting to show them that they have a voice and that they have the ability to build these skills so they can gain additional confidence in managing some of these things that could be causing some anxiety. Enhancing supportive resources. So the two main things here are validating feelings and expressing confidence in our kids' ability to handle these challenges. Some examples could be starting a new school. I think it can be very easy for us to fall into patterns of, it'll be okay, try it out. And that may feel very constructive for us, but really they have a lot of feelings that they don't necessarily know what to do with. And I think being able to say, it's completely normal to feel a little bit nervous about a new school. I get that. Let's talk about what you're afraid of. Let's talk about what you're excited for. Let's create a plan together to do what we can for gradual exposure. Can we visit the school in advance? Can we meet with the teacher first? Let's talk about ways to help make some new friends and reinforce those feelings. Same thing with trying new activities. Validate first. It makes sense to feel a little bit nervous before trying something new. Lots of people feel that way. Let's talk about what makes you feel overwhelmed. Let's talk about what you're looking forward to. Encouraging confidence. Trying out for a team can be something that can cause a lot of anxiety. Reminding them of their effort and their preparation of even just having gotten there. I know trying out for this team is a really big step. You've worked so hard in practice. I see how much you've improved. Trust yourself and have fun. Like, this is just a time for you to enjoy this experience, and really just trying to help minimize some of the anxiety of pass or fail. I have to do this 100% well. I can't just exist here. Us encouraging them to just have fun, enjoy the experience can help build some confidence. Same thing with public speaking. Children get nervous about upcoming presentations. We can help validate those feelings again, remind them of past achievements, give them that confidence booster. You're stronger than you think. You'll do great this time. I understand feeling nervous. I think a lot of people feel nervous. Let's talk about how well you've prepared for this already. Modeling and incremental independence. So modeling healthy coping skills. That is on us to learn those healthy coping skills so that we can teach our kids. So this could be practicing deep breathing together. There are wonderful guided deep breathing meditations on YouTube. It can even be something as simple as 4, 4, 4, and 4. 4 count in, 4 count hold, 4 count out, 4 count hold. And just doing that together until our kids learn to do that on their own as well. And they see us regulating and we can co-regulate together. Learning how to do mindfulness journaling, communicating to our kids. Sometimes my mind feels like it's overwhelmed and overflowing with information too. Sometimes I write things down that are on my mind, and sometimes that helps. Here's a journal, here's some paper, let's try it out together. Modeling calm reactions in stressful situations is a great way that we can model how to remain calm and healthy in these situations. Great example for us as parents is if we're running late. We have tried to get all the kids in the car. We've tried to get everybody through the routine. We forgot things at home. The bell's going to ring. Everybody's stressed. that can show up in a lot of ways. And I think being able to take that deep breath together to say, we're running late, but that's okay. Let's talk about what we can do to get back on track. Once we get there, here's our plan. We're going to breathe together. Let's talk about what our next step is going to be. Helps our kids to learn that unexpected challenges can be managed without panic, and helps us to regulate in the moment too, because none of us love feeling that way. Dealing with unplanned changes, favorite activity is canceled, family routine changes, and our kids can't do exactly what they want. Again, acknowledging the feelings and then asserting a solution. I know you were really looking forward to going to the park today after school, but it's raining. Let's talk about something fun we can do inside instead. And fostering independence. So, like in the previous example, this may be encouraging our kids to ask for where something might be in the store, or role playing, letting some of our younger kids pay at the grocery store to start to build that confidence. Gradually encouraging our older kids to take charge of their daily responsibilities, things that we may still be doing for them, but things that could be helpful for them to build some resilience and some independence, such as, I think you're ready to start packing your own lunch for school. Would you like some help with ideas? Do you want to give it a try on your own? That sort of thing. So building resilience, celebrating efforts and bravery, not just outcomes. There are a lot of different scenarios where this can be helpful. If a child is nervous about swimming, we may say, I'm just so proud of you for giving it a try, even if they've dipped their toe in the water. Same thing with trying new foods. You were really brave to try something new today. Learning to ride a bike, celebrating successes, that you didn't give up. You continued to try, even though it was hard. Speaking up in class. If a child who typically struggles with speaking up answers a question in class, acknowledging that effort and saying, that was a big step. Like, you spoke up today, and I know that wasn't easy, but I'm really proud of how you're pushing yourself. Same thing with making a new friend. When our kids come home and say, I walked up to so-and-so and I said hi, even if they didn't say hi back, even if that didn't flourish into your suddenly best friends, being able to say, that probably was really scary, but I'm super proud of you for trying that. That's awesome. And overcoming homework challenges. If a child's having a tough time with math, acknowledging their perseverance of, you really stuck with those tough problems today. I can see you're improving. It's okay if it takes time. You're learning. We're going to do this together. So, some tools and resources now for parents as we're getting closer to the end. I want to talk about when to seek professional support, because we've talked about a lot of strategies for identifying this, for trying to manage some of these things at home. But there are truly times where this just gets out of hand, where it feels like you as a parent may need some professional support for your child. When to seek therapy is when this is becoming persistent and severe. When anxiety is really interfering with daily life, it's impacting school attendance, friendships, family activities. You're seeing physical symptoms, frequent headaches, stomach aches, stress-related health complaints without a medical explanation, excessive avoidance of age-appropriate activities, like avoiding birthday parties, social events, going to school, frequent meltdowns, excessive worry, difficulty calming down. As I said in the beginning, when the response is so much bigger than the actual trigger. And duration and escalation. Anxiety that persists for months on end or worsens despite additional accommodations and the support that you're offering at home might be a good indication of when it might be time to get some additional support. And when to seek support for ourselves, because sometimes we need that as parents too. If we find that we are really struggling to manage our children's anxiety, feeling overwhelmed, feeling unsure about how to respond, not sure what direction to go in, therapy or coaching in some capacity, parent support sessions can absolutely be helpful for that. Experiencing significant worry about our children's well-being or guilt about our parenting decisions that's manifesting to our own anxiety and guilt and impacting our daily lives can be a time to get some support. If my anxiety, the family anxiety, my child's anxiety is starting to cause additional conflict or tension within our family dynamics, if we're having difficulty reducing accommodations, if we're feeling trapped in patterns of over accommodating, completely avoiding, enabling avoidance behaviors, or providing excessive reassurance, you're trying the strategies we've talked about today to the max, and it feels like it's not making a difference, and it's starting to really impact you as a person, you may need some additional support. And just if you have a desire for additional skills and tools, there are a lot of really great resources out there as well. So self-care for parents. We cannot take care of others adequately if we're not taking care of ourselves. We have the right and the ability to set boundaries and to practice self-compassion. It's important to recognize that we cannot solve every problem for our kids, and it's okay to prioritize our well-being. Parenting is also not about perfection. It's about showing up with love and consistency while taking care of ourselves as well, and trying to avoid falling into guilt or self-criticism when these challenges may arise. So sometimes we need to take a break. Sometimes we need to set limits with our kids, work on reframing our own negative self-talk, either through our own exploration or through therapy support. Building a support network. There are some really great online communities out there to be able to connect with parents who are navigating very similar situations to what you may be. Leaning on trusted friends and family, going into therapy for yourself, prioritizing your physical and mental well-being with daily movement, mindfulness, making sure you yourself are getting adequate food, nutrition, and sleep, and educating yourself about anxiety, which you have taken the first step in doing just by coming to this presentation to learn what to look for, how to recognize it in yourself and in your kids. So this is a list of some tools and resources. There are some great books on this slide. I'll leave this up for a minute just so that everyone can see. You can absolutely take a screen grab, and the presentation is being recorded so everyone can access this later as well. And then one particular book that we really stand behind, this came out in 2024, called The Anxious Generation. This has a lot to do with why children born after 1995 are being labeled and called the anxious generation. And a lot of this has to do with overprotection in the real world, the understanding that things have shifted and it's not the same as it was in the 80s and early 90s. But then under protection in a virtual world as we are growing and learning what risks and what factors our kids are dealing with in the digital age. So this is a great book, as well as the previous list. We're happy to send out some of those resources if anyone has questions. And again, they're part of the recording here. So today we focused a lot on some key objectives to help us better support our kids with anxiety. We've explored underlying causes, help us understand what drives these feelings and behaviors. Also discussed some ways to build some long-term coping skills, empower our kids, and apply these insights and strategies. So I know we only have a few minutes left, but I'd love to open it up if anyone has any questions, thoughts, feedback, things that you'd like me to go over again, or anything I may be able to answer. Nothing. All right. Well, if at any point there are questions or any information is needed, we're happy to answer that for you. We will make sure that everyone has access to all of the information. Just wanted to pull this back up to talk about some of the services that we offer, just in case there is any interest there. If someone is feeling like they do want to reach out, we're happy to get you connected. But ultimately, hopefully this has been helpful, informative, and hopefully helps to make a difference.
Caitlin, thank you so much. I learned a lot, and I will ensure that we get this out to the parents. I know that some couldn't attend because of the earlier time slot than we're normally used to, but do appreciate the time and all the tips. There's definitely some in here that I think and everyone within our school community can learn from and practice with our own kids. So I really appreciate your time. Thank you.
Awesome. Thank you so much. All right, everyone. Well, it was great meeting with you tonight. I hope that everyone has a wonderful rest of their evening, and we will make sure that this recording is available to you.
Thanks, Caitlin. We appreciate it.
Thank you.
Bye.
Bye.